and it would seem to be heretical for me to criticize IUI. The fact is that IUI was only introduced in 1984 by Val Davijan, USC, because infertility doctors at that time couldn't do IVF. Nobody had experience with cell culture in this field except for the Jones Clinic and in Bourne Hall and in Australia and Melbourne. And so it seems so fantastic when Davijan said, well, all you have to do is put the semen in a centrifuge tube, in a simple urinalysis centrifuge that every doctor's office had, and wash it with any kind of media you want, and requires no embryologist. The secretary could do it. And then you just use an infant feeding tube, because there were no IUI or IVF catheters then. And it sounded so fantastic. All you need is an infant feeding tube, which was readily available, and your secretary could wash the sperm, and you would actually be able to do what was thought to be the equivalent of IVF. And there were some ridiculous reports, one from Jeff Scher, showing 45% pregnancy rates, better than IVF by using IUI and hyperstimulation. Fact is, if you do a control study, the success rate with ovulation induction is better with timed intercourse than it is with IUI. But with IUI, you're doing a procedure, so everybody feels good about it. But it's a almost a 4-decade myth at this point, and it's not as good as intercourse, because the sperm goes in and goes out and it's gone, and you're not really able to precisely time the sperm to be there when the ovulation occurs, and the egg is only good for about 8 hours after ovulation. So IVF does its miraculous work even with unknown infertility cause, mostly because the timing is always perfect, and you don't accomplish that with IUI.
So you reckon that from now on, we should just cut IUI and go straight to IVF?
Exactly right.